A new year and a new COVID threat. The CDC reports a nearly 40% surge in cases in December, with the Northeast being hit the hardest. The latest variant responsible for 75% of all new cases there. And with fewer than 1 in 5 Americans having received the latest booster, millions are vulnerable, including children. So now schools around the nation are reacting and reverting back to masking. Dr. Monica Gandhi joins us live. All right, two-parter question here, Dr. Gandhi. Are you surprised to see these mandates returning to some schools? And do you think we'll see even more schools choosing to do this?
To be honest, I am surprised by these mandates because we are now starting the 4th year of the pandemic. The WHO gave a press conference this morning and essentially said we're in a much better place with our high levels of population immunity. Severe disease is very low. We're always going to see cases, most unfortunately, because this is not an eradical infection. And so if the WHO can say that for the entire planet, the US choosing in some districts to mask the people who are least at risk of severe disease, which are children, really doesn't make sense to me. Also, there's been a lot of mass data, and this isn't indicated.
So you're saying it really doesn't make sense to you. So it would seem that the science doesn't necessarily back this up. So is this out of an abundance of caution, do you think? And will more schools likely do this?
I think it is an abundance of caution. I completely supported child masking at the beginning of the pandemic. In fact, I wrote many articles on masks, but I also reviewed the data on masks over the last 3 years of the pandemic, randomized control studies, observational studies in the setting of schools that are well done, well controlled, do not show the benefits for young children. And there are actually some harms for young children, especially very young children learning to speak. So we need to do our balance of risks and benefits at this point in the pandemic, like the World Health Organization has encouraged us to. And I would not encourage other schools to do this. I think it's just going to be done for a short period of time, even in the schools that are doing it.
All right, so the schools that are doing it, you think it'll be done for a short period of time. Do you think it's possible that this could maybe just become a new normal at certain times? Let's say when students return from a break or during the typical flu season.
So this is a great question, because then it goes back to the old data on, did we do mass population masking, especially with the kind of cloth masks that children wear? Did we do that for influenza, RSV, parainfluenza, human metapneumovirus during respiratory pathogen season? And there's actually been multiple studies that population level masking did not change outcomes for those infections prior to COVID. So we're going to have to go back to our old data and say, well, we didn't see the utility of this before, and I don't think this is going to become a new norm. I think anyone who wants to mask can, but you really do have to wear those stronger N95s, KN95s, FFP2s, KF94s, not the cloth masks that you're showing right here with these young kids. They just don't work. And anyone could choose to mask, but I don't think that we can ever mandate again.
All right, very good information there from Dr. Gandhi. All right, Dr. Gandhi, thank you for your time as always. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.